Hi, let's stick with the topic, coronary artery calcium scoring test. So what do we do about it if you do have a positive calcium test? This is where the rubber meets the road, as they say. So I'm going to speak to you just like if we were talking about your specific calcium scoring test, which we do in the office. So when the calcium scoring test is anything but zero, that means it's positive. And the higher it is, and the data is there, shows increased risk of potential blockage. Certainly numbers that are very high may even have a blockage already. Anything above zero is going to indicate that there's some area of arterial plaquing. You can't even see necessarily the soft plaque that sits on top of the hard plaque. So it's not an absolute look inside the artery by any means, but it's a good indicator of how progressive that coronary artery disease is. If it starts young, how it's progressing, you can do these tests serially. So what do we do about it if it's positive? Well, number one, we assess the risk of your heart attack risk, of your long-term blocked artery risk, by two things, essentially. One is going to be your lifestyle. Go back to our checklist we like to talk about. Exercise mitigates the potential for plaque rupture and it slows down coronary disease. This has been proven for decades. Certainly a Mediterranean diet is the diet of choice. Some people will advocate vegetarianism. It's a very hard road to go down for most people. And the PREDIMED study, 2013, New England Journal, PREDIMED, PREDIMED study, showed us with no question that a Mediterranean diet, high in extra virgin olive oil and those types of things, high good fats, is the best diet to both mitigate, slow down, and prevent coronary artery disease, other vascular disease, increase longevity, and even mitigate the potential for other diseases. So there's really no question anymore. If you want to be a vegetarian, that's fine, but you don't have to be that based on statistics that I'm seeing that will allow you to also stay very healthy from a cardiovascular standpoint, especially if you do have a cardiac calcium score that has already turned positive. Stress, it's hard to quantitate. I like to talk about stress because the stresses that we all deal with sometimes are actually beneficial. The body likes stress to increase its strength, so cellular stress, personal stress. Obviously, the stresses that were studied with the Nobel Prize that I like to refer to were extreme stresses of extreme poverty, abusive relationships. They did a study of women that had ill children, people that had severe ongoing stresses. So just like other disease entities that seem to blossom, we saw that increased arteriosclerosis, acceleration of arteriosclerosis also developed in people of that stress level. So it's hard to assess personally, but doing stress relieving techniques such as exercise, yoga, meditation, deep breathing, all those things have shown to not only slow down telomere shrinkage, another topic, but also stabilize arterial plaquing and decrease inflammation. So the blood tests of inflammatory markers, metabolic markers, sometimes even vitamin levels, and certainly let's get to lipid markers, so cholesterol. As you all know, I don't always have the same agreement as some of my colleagues regarding the need for treatment of cholesterol. However, when people do have a positive calcium scoring test, when people do have inflammatory markers, when people have certain lipid markers like a low HDL cholesterol, an elevated LDL cholesterol, an elevated triglyceride level, then those are actionable numbers. And depending on how severe the calcium scoring test is, then we will need to deal with it either with diet, exercise, or even sometimes medication. So the blood testing is very important to predict plaque rupture, all those different areas, metabolic markers, inflammatory markers, lipid markers. Let's move forward. So we have lifestyle, we have blood testing, and then obviously if the coronary calcium scoring test is above a certain number, then we need to go further in making sure that there's not a blocked artery at that time. So for instance, if your calcium scoring test is, let's say, above 600, there's a somewhat high risk that you already have some level of blocked artery, which means an artery that's greater than 50 to 70% blocked. Now, below 70% doesn't necessarily need intervention, but these are starting to advance, and this is a progressive disease. So I hope you get a flavor of how we're going to approach your calcium scoring test if we haven't already. Certainly, if you haven't had one, you're going to get one. If it's been more than a couple of years and you had a positive score, you're going to get another one. Low risk of radiation exposure, low cost, quick time, takes about 5 or 10 minutes actually on the machine. And it's a great way to assess your overall risk because I'm going to keep reminding everybody, heart attacks do not occur in blocked arteries. The vast majority of heart attacks occur in arteries that are less than 50% blocked, which are arteries that would not even be looked at during an angiogram to be fixed with a stent or bypass. So it seems paradoxical, but it's very important to understand that. A heart attack develops from an artery that is mildly plaqued, and then there's plaque rupture. So we need to figure out who's going to have the plaque rupture, how to slow down the disease for the long term for sure. But the people, especially people between 45 and let's say 75 years of age, if you see, those are the vast majority of heart attack victims that end up dying or having severe damage to their hearts. So this is why we need to go looking. We don't wait. Nuclear stress testing shows an artery that's already 80% blocked. None of patients that I know walking into my door with normal EKGs, no chest pain, have blocked arteries of 80% or more. But they have the potential for an artery that may be even 10 or 20% blocked, or just have some mild plaque, to then go on to having that plaque rupture heart attack. And that can be life-ending. It can damage your heart irreparably. So this is why we're going to be proactive. We're going to talk about the calcium scoring test. If you want me to do other videos, let me know. We could go on and on. There's a lot of information out there. This is a test that every doctor, every cardiologist should be using. I'm not so sure they are. But in this office, we're going to be talking about it. Have a great day.